Hello class, so today we're going to go over chapter 3, Developing Prescriptions Literacy Skills. Our topics for this video is going to be elements of a prescription order. And our learning objectives are going to be to identify the elements of a complete prescription order, apply calculation operations in handling prescriptions, and recognizing the elements of medication labels. So, what is a prescription? A prescription is an order for a medication or a mixture of medications written or otherwise recorded or transmitted by a practitioner to be filled by the pharmacist or the pharmacy technicians. Prescriptions may be received in the pharmacy by several means. So you will have a handwritten order where the patient takes the order physically to a pharmacy, a digital or computerized order where the pharmacy will receive that prescription via the computer, or a telephone order. So mainly either the nurse or the physician himself will call the pharmacy and order a prescription through the phone. A pharmacy technician needs to interpret the prescription to determine which calculations will be necessary to fill this order correctly and appropriately. As well, the technician needs to make sure that the prescription is a legal prescription. Okay. There are different legal requirements from each state, but mainly the prescriptions for every single state have the following elements: a patient information, a prescriber's information, and the drug designation. Figure 3.1 and 3.2 allow following slides illustrate a prescription for a community pharmacy and a medication order for a hospital. So the hospital and the retail pharmacy will have some similarities but also some differences, and here is what they are. So here you have a community pharmacy prescription, or sometimes referred to as a retail pharmacy. So this is a pharmacy outside of a hospital or a nursing hospital or a convalescent hospital. This is what a prescription most likely will look like. So you will have the full name of the patient, you will have the drug name, the dose, the signature of the person authorized to prescribe, the number of refills. You will also have the DA number for controlled substances. Sometimes if the medication is not a narcotic or a controlled substance, then the DA number will not be there. You have the date of the prescription. It's very important to have the date of when that prescription was filled, because depending on the drug, the prescription is only good for a number of days, okay, or months, or years. Okay, so it's very important to have that date of a prescription. You will also have the amount of drug to be dispensed. Note is the amount should be written out to prevent alterations. And then you'll have the route of administration. And a hospital order medication, you will have the following person's identification. So like in the retail setting, you would have the patient's address. Here you will most likely just have the date when the patient was administered. You'll have the physician who admitted the patient, and you'll have the room number of the patient as well as their account number or MRN number. So here's an example. So patient identification, so you'll have the name and identification number. You'll have their date of birth. Like I said, this address would not be in there. you would have room number and bed number. So here in this section is the bed number, the name and dose of the medication. So here you have the prescription, so the name of the medication and the dose. So the name is Dilantin and the dose is 300 milligrams. You will have the date and time of the order. So when, again, we said time, the date is very important. The route of administration, so this is an oral medication, and the physician's signature or name of the physician plus the signature of person who took the verbal order. Okay, so you'll have that information there as well. So patient information. So every prescription order must have enough information to identify that patient. In addition to the patient's full name, first and last name, most states also require outpatient prescriptions to include the patient's address, so their street, city, and state. It is also good practice to include the patient's age or date of birth on every medication. And why is it important to have the age or the date of birth? First of all, maybe billing information. So in order for the prescription to be paid by the insurance company, date of birth is important. Again, having to do with that identification of the patient. Also, if the patient is a child, you will need that date of birth or that age because the dosage of that medication will be different than an adult. Prescriptions for inpatients, so again, this is hospital setting patients, also are referred to as orders, not actual prescriptions. Usually substitute the patient's hospital identification number and room number for the patient's address. Okay, so you typically won't see a patient's address on a order in a hospital. The patient address is just written in their medical account number. Prescriptions orders are typically submitted electronically or written on a form pre-stamped with the patient's admission date, the admitting physician's name, and the patient's date of birth, in addition to the patient's name and the hospital number. An important thing to note is also the difference between a hospital. We said that in the actual patient's identification, you'll have that admitting physician's name, but that does not necessarily mean that that admitting physician will be the one writing down orders for those patients. So there's possibly an admitting physician that will admit the patient in the ER setting, but once the patient gets admitted, they are going to be transferred to a unit in the hospital, and in that unit in the hospital, that ER physician will not be the one providing the remainder of care in the hospital. So it'll be either the physician doing rounds in the hospital for that day or for that week, and then it might be an on-call physician that is taking over patients in the night. So it's very important to make sure that if it is a written order in a hospital, that whenever you're entering that prescription into the hospital's computer, that you put down that ordering physician's name, not the admitting physician. Okay, that is a very important key in a hospital setting. Another thing that you'll include is the height and weight. Again, those information is also important to do with the way you're going to order medications, because sometimes the physician will base it off of the patient's height or weight. Okay, because again, elderly people as well, they might need a different dose than it's already made for middle-aged patients. So you'll see these weights in different measurements, either kilograms or pounds. And again, these things are different. So 100 kilograms is not the same thing as 100 pounds. So you have to make sure that whenever you're entering this information into the computer, you're entering the correct information. Because I guess, like I said earlier, sometimes physicians will base it off of the weight. And if the information is entered into the computer incorrectly, you may misdose the patient. And could lead to various, first of all, medication error. And then another thing is that they can either get too low or too high of a dose and cause consequences, even deadly consequences. So it's very important to pay attention to this information. Also, the height can be written either in centimeters or inches. Prescriber's information. In most states, outpatient prescriptions orders must include the name, the authority of the physician, so if it's a medical doctor or doctor of osteopathy, or if it's a nurse practitioner or things like that. It will also include the address of the prescribing practitioner. Frequently, the prescription order includes the prescriber's telephone number. Prescriptions for controlled substances must also bear a registration code known as a DEA number. So the DEA number is issued by the Drug Enforcement Administration, an agency of the federal government, and signify the authority of the holder to prescribe or handle controlled substances. So again, the DEA DEA administration are the ones in charge of giving that prescriber the authority to write or prescribe controlled substances. The DEA number has 2 letters followed by 7 digits. The last of the 7 digits is a check digit, calculated by the following steps. So look in table 3.1. Will give you the information that we need to make sure that DEA number is correct. So the first 2 letters of the DEA number provide information about the prescriber. So the first letter is usually, but not always, designated the level of authority of the holder. So here are some examples that you will see in an actual prescription. You'll have the letter A, B, or F. A and B are the primary level practitioners, such as physicians and dentists. M is used to indicate the mid-level practitioners, such as nurse practitioners, nurse midwives, nurse anesthetics, clinical nurse specialists, and physician assistants. The second letter in the DEA number is the first letter of the prescriber's last name. So here are the steps. Step 1 is to add the first, third, and fifth digits of the DEA number. Add the second, fourth, and sixth digits of the DEA number. You're going to double the sum in step 2 by multiplying by 2. And then you're going to add the results of step 1 and 3. The last digit of this sum should match the digit should match the check digit, the last digit of the DEA number. So here's an example. A patient brings a prescription for methylphenidate tablets to the pharmacy designed by Dr. Johnson and bears a DEA number of BJ2345678. Could this be a valid DEA number? So again, we're going to check it by adding the first, third, and fifth digits. So that's 2 plus 4 plus 6 is equal to 12. Add the second, fourth, and sixth digits of the DEA number. 3, 5 plus 7 is equal to 15. Multiply that by 2, so 15 times 2 is 30. Add 12 and 30 equals 42. So 42 and 8 of the last digit of DEA number do not match. So this will be considered an invalid DEA number. See you in the next video.